Hello everyone. Today we want to talk about the diabetes mellitus. Diabetes mellitus in abbreviation is DM. Diabetes mellitus is the increase in the sugar levels more than normal in blood. That is more than 7.8 grams per deciliter for the non-diabetic patients, and for the diabetic patients it increase in sugar level more than 11.0 grams per deciliter. We have the two different types of diabetes mellitus. We have type 1 diabetes mellitus and type 2 diabetes mellitus. On type 1 diabetes mellitus, this is where the pancreas is unable to produce sufficient insulin to convert glucose to glycogen or to convert glucose to fats. Thus, this can be due to inflammation of the pancreas. That's the disease of the pancreas, which causes it not to produce enough insulin. On type 2 diabetes, this is where there is enough production of insulin, but the cells of the intestines are unable to take in the glucose in the blood, thus causing the increase in the level of blood in the system. And so we want to talk about the pathophysiology of the diabetes mellitus. As we have known, diabetes mellitus we have type 1 and type 2. So diabetes mellitus is usually caused by either insufficient production of insulin or caused by inability of the cells to take in the glucose in the blood. So when there is when the cells are unable to take in the glucose in the bloodstream, the impulse or the stimulus is sent to the liver, that there is increase in the amount of glucose in the blood. Thus the liver responds by converting the stored fats into more glucose. Thus in the process of converting the stored fats into glucose, it increases the level of glucose into the blood, thus increasing the amount of glucose. Another thing is when the stimulus is sent to the liver, it converts the proteins into fats through the process of gluconeogenesis. Thus in the process, it increases the level of glucose also in the blood. Thus one starts to experience hydration, increase in thirst, and so on. That's all on the pathophysiology of the diabetes mellitus. Thank you.